Eddie Kilbride with Kilbride Plastic Surgery. Today's patient story, the Nefarious Neuroma. So my patient's a 78-year-old who had a left thumb melanoma of the nail, and this was treated with an IP joint level amputation. At the time of his amputation, he had traction neurectomies performed, and this is a procedure in which the radial and ulnar digital nerves supplying sensation to the palmar aspect of the thumb are transected deliberately proximal, significantly, to the level of the amputation. But unfortunately for this patient, this failed tremendously, and he developed severe, intractable, and debilitating pain of a symptomatic neuroma. So much so that he went on to have 2 additional procedures specifically for this. The first shown here, which is centro-centralization, in which a nerve allograft was used to bridge the radial and ulnar digital nerves, as shown here, in an attempt to mitigate this pain syndrome. This failed, and then he went on to have this RPNI procedure, regenerative peripheral nerve interface, in which muscle grafts from the brachioradialis were used to try and satisfy these radial and ulnar digital nerves. Again, unsuccessful in alleviating his pain. So he was sent to me after this, and I'll let him tell you his story a little bit.
It's mainly
like kind of right in.
Underneath here. It's like that's why I say I can't grip anything, because the minute I put my hand down on something,
anything, like if you were trying to grab this pen.
Yeah, but see, I grab everything like this now. I don't even come close. I don't put anything
in that area.
In this area, whatever I do, it's these 4 fingers. I've learned how to use these 4.
See.
I don't sleep more than 20 minutes at a time. As soon as I move my hand,
you feel
it touches something and it wakes me. You know, that's how it is now.
I see. Okay.
And this is how frustrated I am. I can't get any relief.
So I decided to take him to the operating room, as shown here. Here's just the outline. And I explored the previous operative field more proximally and found this. These were the RPNIs, which were essentially just scar at this point.
Now, most recently sent to me after failure with RPNIs. You can see these RPNIs have no vascularity. It's basically all scar. There's no semblance of muscle. That's really here on these nerves. So we're going to transect these and utilize the hydrogel nerve cap.
So this was performed. Those RPNIs were excised. The nerves were transected more proximal, and the hydrogel nerve caps were applied to satisfy these nerve endings. And here he is at 7 weeks post-op.
We're 7 weeks out. He had RPNIs, multiple surgeries, but most recently RPNIs to the radial and ulnar digital nerves of the thumb. He had exquisitely tender neuromas here, which have gotten markedly better.
So notice that I'm aggressively palpating and touching his thumb for the first time.
So I can do that.
Okay.
That's not a problem. Because like I said, now the pain, I can hold on to something.
And as you can see, he's back to using his hand and gripping objects, as shown. So very pleased with his outcome. I'm glad I was able to offer him a solution that was successful as a salvage effort, despite multiple very valid approaches to treating and preventing his neuropathic pain. So I really hope you enjoyed this case of the Nefarious Neuroma. As always, make sure your surgeon's board certified, ask for photographs, and I hope to see you for the next patient story.